at Asian Fidelis Hospital, Faridabad. Today's topic is a very pertinent and important one. It's about air pollution. So we keep hearing about air pollution throughout the year, and more so in the winter months, that air pollution is choking us, it's causing a lot of health issues. But what exactly does air pollution do, and what can we do about air pollution, both at an individual level and at a government level? What can we do to save ourselves from air pollution? And if we are already affected by the effects of air pollution, what can we do to save ourselves? Is what I'll be talking about to you in the next maybe 5-7 minutes. Starting with air pollution, we all know, living in Delhi NCR, that air pollution is a very important health issue, a health hazard to all of us. So, what is it about air pollution? So there's PM 2.5, PM 10. You would keep hearing these numbers all through the year. So this is the particulate matter that's there suspended in the air. And what does this do? This basically goes through the airways inside the lungs and causes a lot of inflammation in the airways. There are other gases, nitrous oxide, sulfurous oxide. These are again very, very hazardous. So anything less than 50 AQI is good. Anything above that is bad. So what do we average around in Delhi NCR? More than 300. So I've talked a lot about numbers. So what does it do? Right from your brain, right down to your lungs, to your digestion, to even growth issues in children. Air pollution can affect everything. You would be surprised and astonished to know that in Delhi NCR, they conducted a study in which they had tested newborns, the blood from newborns, and they found 287 harmful chemicals. That is a lot of harmful chemicals to have in a newborn child. So where does that come from? It comes from the air, majority, and some from obviously water pollution as well. So the purpose of this presentation is not to educate you about air pollution only, but what are the practical things that we see in our daily lives, what we can do. So come mosquito season, every one of us has had incense sticks and mosquito coils. So mosquito coils, something like one mosquito coils, you would be surprised again to know that it generates smoke, carcinogens, and air pollution worth 100 cigarettes. Yeah, one mosquito coil. So, which is used in almost every household in India. The other thing is other sources of pollution, be it vehicles, be it burning crops, burning other debris, burning garbage. So these are all various sources. So the next thing is, now we know that air pollution does damage to our health. It causes cognition defects in the brain. Cognition defects means that our brain processing power is even affected. In a certain study conducted in China, it was found that children living in big cities with a lot of air pollution were found to have significantly lower IQ levels, randomized for age and ethnicity included. So, what does that mean? Significant air pollution, not only does it cause significant asthma in young children, but also causes lower IQ levels to happen. So it is very clear that it's extremely dangerous. So what can we do about it? So air is something that we just can't stop breathing, right? It's right there. We can't stop breathing the air that is around. So what can one do? The best thing would be maybe you get out of the polluted and caustic atmosphere, but that's not an option that every one of us has. So what can one do? COVID has taught us the use of masks. So masks, they protect us from COVID. And what else do they do? Yes, they also protect us from a lot of effects of air pollution. It filters out a lot of bad things in the air. So masks. The other one, what else can we do? Yes, prevent from going outside, since air pollution levels are more outside. But you would be again surprised to know that indoor air pollution is also a very, very significant cause of morbidity. What is indoor air pollution? You would say कि मैं अपने घर में हूँ, I'm safe from the effects of air pollution. But it's not as simple as that. Indoor air pollution is generated from everything, right from cooking to the chemicals that we use for cleaning our houses. We use a lot of chemicals to rub and brush and all that. So that's a significant source of air pollution. The gadgets that we use, the electronic devices, they are all causing the air to be polluted. So, where were we? Yeah. So, prevention, masks, yes. What about diet? Can diet help us prevent the effects of air pollution? Yes. Studies have shown that increased hydration, drinking of upwards of 9 or 10 glasses of water a day, seems to cleanse the body. Yes, it has. What else can we do in the diet? We can. What has been proven is food which are rich in omega-3 fatty acids, they are proven to reduce the effects of pollution. So what is that? That's a lot of seafood, groundnuts, lot of dry fruit. This has proven to be efficacious. Well, this is what you can do on an individual level for yourself while you are changing your diet and fluid. What about an individual taking the responsibility of not generating that much air pollution? If that's the single most important effort that we can do for us and our children, is be a little conscientious of things that we are doing that generate air pollution. It could be a single thing that you can do for yourself. Maybe take that extra public transport ride, maybe not burn garbage outside, maybe not just broom away all the dirt to the road and uh, in turn causing air pollution. Maybe not burn your uh, crops that generate air pollution again. Maybe all your biodegradable waste, we shouldn't burn it. So we, each one of us can do some one little act which will help this cause. The other thing, obviously, at a government state level, not the individual doesn't have that much of a say in that, but there are efforts that are being done in a lot of cities in the world. In times of severe air pollution, there are drones that are being used that are helping to spray water, which are getting the air pollution levels down. There are norms that are being created for monitoring air pollution and monitoring the vehicles. The electronic way, the e-vehicle revolution is knocking on our doors. That looks promising in reducing air pollution. So those are the things that we look for in a hopeful way in the near future. So what can you do in this? Like I said, try to reduce whatever you can, try to save yourself whatever you can. So another question that I keep getting is, what about air purifiers? How do they work? Do they work? And who should get it? So for starters, air purifier is a device obviously which gets the air cleaner. How does it work? With a lot of technology, filters, HEPA filters are commonly available these days. So, what are the prerequisites for it to work? So, the air purifier should be in a confined space, a space which is, the window shouldn't be open, the door shouldn't be open, because then the effect is more or less nullified. Who should get one? People with chronic cardiorespiratory diseases should, if they can, get an air purifier, because it has proven in studies to reduce worsening of these chronic diseases. So, so that was my short talk on air pollution. I would be happy to take any questions or any other comments or anything that whoever has been listening to me these past few minutes to come up, and I can answer, or I can take questions on respiratory other issues as well. So I've got a question, or which is showing. I'll just read it out. I'm having cough, not constantly, but 6 to 7 times a day. I think it's due to air pollution. Should I worry? So yes, in fact, if the cough has been lasting more than a few weeks or in consecutive years more than few months, then it could just be the beginning of chronic bronchitis. Chronic bronchitis is the single most commonest respiratory condition that we see that happens to people who are chronically exposed to high and dangerous levels of air pollution like we have in Delhi NCR. What should you do? I would recommend you to go and see your respiratory physician so that they can examine you. Maybe conduct a pulmonary function test to see if your airways are functioning just fine. And if needed, we could medication. And for the next thing, sorry for that interruption. I think it was due to a technical glitch. I've got another question. When I wake up, I have a blocked nose. Can I do some breathing exercise before going to sleep to have a better sleep? If you are having a blocked nose, this is more often than not something to do with the sinuses, and a condition called allergic rhinosinusitis. And if it is causing a repeated blockage of nose, if you are having persistent symptoms like postnasal drip and blocked nose or sneezing, breathing exercises won't really help to open that blockage. You would rather be benefited more if you are to get it evaluated by means of a ENT doctor or a respiratory physician who can guide you further about what to do about it. You might be needing a nasal spray or an anti-allergic to improve the situation that you find yourself in. Oh yeah, there's another question. How can I keep my 6 months old baby healthy in Delhi's bad air? It's a very important question. And so, like I had mentioned in one of the slides, in a certain study, we had found so many chemicals that were there in the cord blood of a newborn child. So, what can be done? Prevention at an individual level. What you can do is, as much as you can stay indoors, and as much chemical free environment you can maintain. There are few plants which are proven to be plants which can remove certain bad substances from the air. It's like, for example, a rubber plant. If you have a rubber plant, that helps to sort of clean the air a little bit. But an air purifier might work, especially if your young baby has started developing certain allergic symptoms like a cough or wheezing or breathlessness. I've got another question coming in from yeah. I'm a salesperson and travel on my bike in Delhi. I have cough issues on daily basis. Can I wear something to help me with this? So, like I had mentioned, a mask. COVID has taught us to use masks. Masks are really beneficial. If I am to go through percentages, a nicely fitted cloth mask helps you at least 30 to 40%. Reduces the kind of air pollution that you're exposed to. If you can wear an N95, then it would prevent or save you from at least 90% of the pollutants that are there around in the air. So I would recommend that if you are on the road the whole day, and if you're on a bike especially, you can wear a mask If you can wear a surgical or an N95, that will be the best for you. So I've got another question. I use an AC and air purifier. Is it enough to keep my house PM level low, or can I plant something as well to keep the air quality good? So, like I had mentioned, you can get yourself a rubber plant, and there are some very other plants as well which you can use. I'll just let you know. 1 second. So yeah, a bamboo palm, and a Boston fern and a spider plant. Out of these, I think what you can get and are available around us are bamboo palms and rubber plants, which you can use. So there's this certain study that I'm going to, tell you about, that they had created a potted plant microcosm in a certain office in Sydney, Australia, and they had found that the air pollution levels went as low as 30%. I mean, 30% of the original values after planting these many plants in their office. So yeah, you can go ahead and get yourself some plants, and that will help to clean the air a bit. So should I see a doctor if I'm coughing and sneezing almost every day? There's also the second part to a question, that you don't go out that much but are still facing these issues. So I would say that if you're having a cough and if you're sneezing almost every day and it's affecting your quality of life, most likely you have something called severe persistent allergic rhinitis. Uh, if you are having these symptoms for more than 4 days in a week or more than 3-4 months in the year, then definitely it's persistent allergic rhinitis, and you might need regular medications. And if you are needing those medications on a daily basis, then the next step would be to consider you for something called immunotherapy, which requires us to first check what are you allergic to and then plan for immunotherapy ahead. So thank you for joining our video. I hope it was, informative and educational, or at least it got some message that what are we up against, and a bit about at least what can we do for ourselves. Thank you.